Hello, everyone, and thank you for joining us on this episode of Health and Family. Today, we turn our attention to one of the leading causes of death among men, that being prostate cancer. We hope that with today's program, men will feel more empowered to go to their doctors to get answers and support to assist with any ailments they may be experiencing. Helping us to find out more about prostate cancer and what it entails are event and program manager from the Bermuda Cancer and Health Center, Mrs. Azuree Williams, and prostate cancer survivor, Detective Nigel Richardson of the Bermuda Police Service. We welcome both of you to Health and Family. Welcome. So you were no stranger to us. You come to us quite a bit anyway. So we wanted to talk about the top cancers that are diagnosed in men today. I know prostate is definitely...
Prostate's number one.
I figured, yes. So.
And then we have colorectal and lung in Bermuda. Those are the top three.
Okay. Is prostate cancer a fast-growing cancer among men?
Prostate cancer is actually slow-growing.
Okay.
With most men, it grows pretty slowly. It can even go undetected for decades. It takes a long time for it to show its face. However, you do have some people who are diagnosed with an aggressive prostate cancer. So it all depends on many different factors and the background of the actual patient.
Okay, and we welcome you, Mr. Nigel Richardson. And as I said earlier before we were started taping, thank you for doing this. This is a big godsend for us for you to do this. So you were diagnosed with prostate cancer at a relatively early age.
Correct.
Talk to us about that.
Yeah, I go to the doctor every year for an annual. Mm-hmm. So when I was 39, I went to my doctor for my annual full medical. And some of the results came back. They were not correct.
Right.
So he sent me back for some additional testing. Mm-hmm. And when those results came back, he was a bit concerned that some of my scores just didn't seem right and it didn't sit right with him. So then my doctor sent me to see a urologist, a local urologist, just to confirm the earlier results. Yeah.
Okay, you talked about scores. These are the PSA scores?
Yes.
Okay, so let me come back to you. PSA means what exactly? No, I guess it's an abbreviation.
Yeah, it stands for prostate-specific antigen. Okay. And it's basically an enzyme that's found in the bloodstream. So doctors will do a blood test to test for the PSA to see how high the levels are in the prostate.
Okay. Now, this runs in your family, this prostate disease? All right, talk to us a little bit about that.
All right, so prior to me being diagnosed, I didn't know of it running in my family. The only one that I really knew of was my grandfather, having lived with him and growing up in the house. So I used to see him, getting ready for work or getting ready for church or whatnot and events. And I just remember him having the bag and whatnot, but just going about his life as normal. Like it wasn't no...
The bag? What do you mean by the bag? To hold your urine?
To hold the urine,
okay.
Yes. So he just used to get dressed, cover up and just go about his daily life.
So nobody really saw the bag per se, unless
unless you knew that he had it.
And so your grandfather had it, did you think, hey, does this run in my family, or?
I didn't, because growing up, you always hear the rhymes and whatnot, so you always hear it's an old person's disease. So it never resonated with me that, okay, my grandfather had it, then my uncles or my brothers or whatnot. It just didn't dawn on me.
So were you the first grandson or son? Well, you said your grandfather, so were you the first one in the immediate family to get it, or were there other members?
There were others, but again, it was never talked about.
It was secret, yeah.
It was sort of secretive, so even from my uncles, but in my immediate family, I was the first one out of 3 brothers.
Okay.
And then my older brother was diagnosed, I want to say 3 years after me. And then my younger brother, unfortunately, he passed away, but he passed away from leukemia. So that's something else. Yeah.
Okay. Mrs. Williams, talk to us about the stats of prostate cancer here in Bermuda. How is that looking? And well, answer that first, and then we'll go to the demographics.
So currently, we don't have any up-to-date, accurate stats. The last report from Bermuda National Tumor Registry was in 2015, and their stats were 56 reported cases in Bermuda. So the problem is it's not mandatory for doctors to report the cases, and so we only know of those cases that are recorded, that are reported. And we're hoping that one day in the near future that legislation will be passed to say that it's mandatory for doctors, so we know what stats we're working with and we're able to best serve the public.
Because I know you did the breast cancer show with us. Was that mandatory to report? That's not mandatory as
cancer.
well? Wow.
No.
All right. So what was your reaction? Take me back. You go to the doctor. He's saying you need to go get it checked out. And then you find out that, yes, you do indeed have prostate cancer. What was your immediate reaction?
I was sort of thrown back, but
because 39.
39 is kind of
the height of
you
it,
know,
it's not the norm.
It's definitely not the norm. So I was taken back, and then my current wife, it wasn't my wife then, you know, we were just going together. She came and we sort of sat and we talked, and we were like, well, this isn't the end of the world.
No.
And literally didn't tell too many people. I told my mom, a colleague of mine, and I think a cousin was all I told in that first maybe 24 hours, 48 hours. And then it was Google. After that, it was WebMD.
Thank goodness
it was
for
just
internet, yeah.
In all honesty, I think I spent maybe a week or so just
researching.
researching you know, how it's going to affect me, what I can do to go forward, how I can better myself. Yeah.
What factors what symptoms did you experience? You said your grandpa, he had to have the bag with him.
Yeah.
Was that also your experience, or?
No, it wasn't mine. So,
Okay.
so what happened was that my cholesterol. So for me, I was fit, healthy, active, the whole works. But you got your good cholesterol and your bad cholesterol, and they came back, and that's where the bells and whistles went off, because those numbers weren't correct. So then that's when the doctor sort of sent me back to have more tests.
Right.
And then from that was when I found out that my PSA was, it was 5.1 when I was 39, and then when I went back 6 months later, it had jumped up to 5.7. So within a 6-month period.
Because usually one of the symptoms is frequent urination, correct?
Yes, correct.
And so did you have that, or not as much?
Not as much, because again, I was active, so I was, cycling, running, so I was drinking a lot anyway.
Right.
So for me, getting up 2-3 times throughout the night was, I thought was normal, not realizing that it's not normal to get up 2, 3, 4, 5 times throughout the night. Most people sleeping, they might get up once.
Right.
Yeah.
Yeah, it's not normal, because I'm thinking of overactive bladder and stuff of that. No,
Yeah, it's not.
It's not normal.
It's not
okay.
normal.
So back to you, Azuree. As far as treatments available on the island, talk to us about how that's working out. Can we treat it here on the island,
yes,
or do we need to?
definitely.
Okay.
Our center currently has serviced several prostate patients and prostate cancer patients, and men have many options. They can either go and get the surgery, and then they can come to our center for radiation therapy. There are different forms of treatment that men may choose that we don't necessarily offer on island, but we have very competent professionals here. We have our own urologist. We share him with the hospital, Bermuda Hospital, Hospitals Board, and he offers biopsies weekly at our center. So men who also need to go and get checked, they suspect they may have prostate cancer, or they know that they have a family history, and if they've been to their regular GP and the GP will send them over to the urologist, they will come to our center if they choose our center. And the urologist will give them a biopsy, and then he'll give them a consult if the biopsy comes back positive for prostate. And then he'll give them the options as to which would be best for them.
And so it's one of the more treatable cancers pretty.
Yeah, definitely. I mean, especially if it's caught early, and with it being a slow growing cancer, that the chances of it being caught early are really good. if men are going for regular checkups and consulting with their doctor when they go for their annual, if the minute, like Nigel was saying, if for him he didn't think it was abnormal because he's an athlete or he was cycling a lot and you drink normally. But for those men who know that they're not drinking a lot of water throughout the day or a lot of beverages, that if they're constantly urinating at night, those are signs and they need to be consulting with their doctor.
Okay. Now, the prostate, this is something just strictly for men, or?
Yes.
Strictly for men. Okay.
Yes.
Just wanted to ask that. All right. We're going to take a break right now. We'll continue with the conversations with Mrs. William and Detective Constable Nigel Richardson. Stay tuned.
Healthy people and healthy communities.
Keeping active reduces the risks for diabetes, heart disease, arthritis, and stroke. These conditions can limit your lifestyle, but they are preventable. Exercise and a healthy diet are good for all ages, so make them a part of your daily life. Walk more often. Take the stairs instead of the elevator. Leave the car at home sometimes. You'll be amazed how easy it is to be more active. Get on the move to a healthier you. This is a message from the Department of Health.
Welcome back. If you're just joining us, we're talking with Mrs. Azuree Williams from the Bermuda Cancer and Health Center and prostate cancer survivor Detective Constable Nigel Richardson, and we welcome you back. So as I said earlier, and I keep having to say thank you for doing this, because I'm going to be real, a lot of men don't like to go to the doctors.
Yeah.
Sort of expand on that, because I said you do go. Is it because you're a police officer and you have to go, or?
No, I was just always going to the doctor. That's just my nature. And it's kind of odd because I'm in the middle of three brothers, and my older and my younger brother, they sort of wouldn't go to the doctor, would have to press them.
Yeah.
And it's like your health, it's your well-being. But even a lot of my colleagues just won't go to the doctor. And I think there's a stigma, and especially with black men. There's an image in your head of some doctor, male or female, putting on a glove and
Be real.
bending you over and telling you, relax.
Mrs. Williams was a proponent of you coming on. I had somebody else that wanted to come on. She's like, no, let's go with you. And I said, sure. Now I know who you are. And I'm like, oh, okay, I remember you. So obviously we're all glad that you went, and we're glad that you're in remission now. How does that work?
So I've been cancer-free since March 2011.
Amen.
That's when I had my surgery at Brigham in Boston.
Right.
So I had the Da Vinci, which is the robotic surgery.
Okay. Talk to us about that.
So the doctor who performed my surgery was Dr. Jim Hu. So he was the chief urologist at Brigham in Boston. And the Da Vinci was, for me, the better option. I don't like to say best because, you just never know. But it was the better option for me at my age, 39 going 40. So back in the day, they used to have the general, where you'd end up with a 4-inch or 5-inch cut from your belly button going down. The Da Vinci is the doctor's behind a robot, and I have 5 little incisions that are maybe half an inch on either side and one in the middle.
Right.
And the robot sort of just goes in, I guess it capulates it, finds the prostate, takes it out, and sews you back up.
Recovery time? What was that like?
I had to stay in Boston for 10 days after the surgery because I have a catheter. I'm wearing a catheter. After the 10th day, they want to make sure that you're all healed on the inside and that you can actually hold liquid.
Right.
And what I forgot to mention is early on, if you're diagnosed and you know you're going to have surgery or one of the options, is they tell men to do these Kegel exercises.
Similar to
Now,
what
women,
do.
yes, for after birth. And it really helps men. So it helps you to hold, because the prostate, once it's gone, there's nothing to hold that urine in the tract.
Oh, okay.
So it'll just,
Be constant. So that's
drizzle.
what your grandpa had to, that's
Yes.
what he had, why he had to have the bag.
Correct.
Oh, wow. So I wanted to just change channels a little bit and talk about why men, and I can come to you, but let me start with Ms. Williams, why men generally don't like to go to the doctor, and what can we do to hopefully this program will change that. But what can we do from your standpoint?
Well, like Nigel was saying, it's taboo and many men are uncomfortable, and we suggest if you don't want to go to a male, choose a female doctor. And thinking that this is your health, taking control. Prevention is the best key for a healthy lifestyle. And prevention means that you go to get screened, you go to your doctor, you get checked. If you don't do the prostate exam, you get the PSA test, which is the blood test. It's not always the most accurate, but PSA testing is normal. It's done on a regular basis. And we suggest that men starting at age 45, especially if they're high risk, that they start getting their PSA tested annually. And when it comes to prostate cancer, we're looking at, it's typical for men in their 50s and older. Nigel, which is why I wanted him to come on, it's rare to see someone under 40 being diagnosed with prostate, but because he had that family history, it puts him at a higher risk. So the more relatives you have, especially close relatives with prostate cancer, that puts you at a higher risk. So it's important specifically amongst black males.
Why black males?
To be more vigilant, because what we've seen when it comes to, what the research shows when it comes to family history, it's a higher risk amongst black men. However, you do have white males who are at risk for prostate cancer, but they may not have a family history. But we do see prostate cancer diagnosed more in black males. And that could be to do with diet. That's part of the risk factors and causes as well. So when you have a diet that is high in saturated fats and the types of foods that we're eating, those who are obese, overweight. So the recommendations also from us is when it comes to prevention, you should be exercising at least 30 minutes a day. Many of us don't do that. Eating lots of fruits and vegetables on a regular basis daily, 2.5 cups of fruits and vegetables. That's going to help your immune system to be stronger, healthier, getting lots of sleep, at least 8 hours daily. I mean, it's very hard. It's about lifestyle, right? It's about the choices we make. So many of us are, whether we're male or female, we're busy, working, juggling family, whatever other additional activities. And it's really about taking control of your health, talking to your doctor, not being afraid to push and ask those questions if you don't know the answers and you want to know. So males, if you make that appointment, wives, spouses, whoever your loved ones are, if they're encouraging you, because we're the ones, when that person is diagnosed, we're the ones that have to be there to support you. And it's best to get it checked early, catch it soon. The sooner you catch it, the less struggle you're going to have with it if you are diagnosed with it.
Oh, that is so true. So I wanted to bring up that word, insurance.
Yes.
If a gentleman is maybe does not have so much insurance or is no insurance at all, what can they do to get assistance with this?
Well, one, going to a doctor. I mean, they may not have coverage for a doctor, but our center, we have our Equal Access Fund, and the Equal Access Fund subsidizes anyone who comes to our doors requiring the services that we provide. So any man who's sent to us who needs a prostate biopsy, we're not going to turn them away. They will be subsidized. And then if it's decided that they require radiation therapy, again, they'll be subsidized if they don't have insurance or if they're underinsured. So we won't turn anyone away. Our services are there. We're constantly fundraising throughout the year. We're very grateful to the public, the community. We have the private donors, sponsors, constantly giving, and they are making sure that the Bermuda's first radiation therapy unit is up and running. We've been around for a full year now, and it's exciting to know that we're able to provide this service to the community, and we don't turn anyone away.
And that's good news. So I wanted to talk about if the cancer reoccurs, and I'll come to you and follow up with that. So if it does occur, so I'm assuming you go yearly for your yearly visits, for your yearly doctor visits?
So, well, in the beginning, after my surgery, which was in March, it was every 3 months. I would have to follow up, and that for 5 years. So if my score stays below a certain number for 5 years, the
That PSA score?
yeah.
Yeah.
Then they say the chances of it coming back is like 0 to nil. So I was going to Boston every 3 months up until the third year. And in all honesty, I just got tired of traveling. So I was just like, I'm not going to Boston anymore. I'd have it done here in Bermuda. And then on year 5, I got the all clear, and I'm good. Yeah.
Great news. And so, but if he had to get it, he can get it checked here in Bermuda,
Yes.
if need be.
Yes,
Okay.
and basically the urologist, when they have patients, they will screen through the PSA every year. It's something they have to do annually. And men, like we said, at 45 should be, if they're high risk, at 45 they'll be screening annually. There's no international consensus on a set age,
Right.
but here in Bermuda they do it annually starting at age 45.
And-
the PSA testing,
All right,
screening,
and then
yes.
your insurance would normally kick in and cover that if you're insured.
If you're insured, yes.
Okay. I wanted to talk about, were there any side effects after the surgery?
I mean, there were a few, but every man is different. So for me, someone who was active, I was fatigued in the beginning, and then I'm trying to think. I think it was mostly the. For me personally, it was the fatigue in the beginning.
Okay.
Not allowed to lift anything or do extreme exercises. It's just a moderate, and it was almost like a setback for me because you would just want to get,
Right, and
right
you're
back
such
up
an
there.
active person, so that
Yeah.
you had to take it easy after
Take it
that,
easy
huh?
for a while.
And so, but you're riding bikes and doing your normal stuff, or you had to ease up on that?
I'm not back to my 10Ks, which is what I used to like to do,
Right.
but I get out on the bike and I go mornings for like 40 minutes an hour, so I do get my exercise in, but I'm not where I was.
Okay. Well, you're like 6 years, 7 years?
Almost 8 years.
Almost 8 years. Alrighty. Well, unfortunately, time is almost over, but let's just talk about support or help, the support group. So let me come to you, and then you close out for me. Cool?
Okay, so we actually have different programs that we offer. So one of our highlights for men is our men's health screening. So it's open to the public. It's a free event. We hold it every year in November. And it is an event where men can come. They can get screened for blood pressure, blood sugar. We do lung, kidney, all sorts of screenings that they can come. We have many healthcare providers, free vendors. They don't charge. We have doctors on site for consultation. And it's an excellent program that we offer to men who haven't been to see a doctor and they haven't been screened for anything. So they're able to come. We even offer prostate exams. This year we'll be having our urologist there again. So it's really a great event. We're very thankful to the healthcare providers that come. And then we've recently started the prostate group at our center, and Nigel can briefly speak about that.
All right. So you went to a support group as well?
Yes.
Okay, just
So it's actually pretty new in Bermuda. So when I was first diagnosed, it was only people that I knew had been through it. So we were each other's support. But about 4 months ago, maybe 5 months ago, we started a local support group for men.
this is located at the Cancer and Health
Yes.
Center? Okay, great.
Yes. So we meet once a month. I want to say there's maybe 13 or 14 of us currently who are all survivors.
Okay.
And we've had one or two new ones come. So we share stories. We try to help each other, because everyone's struggle is different.
Yeah.
And the ages from myself being the youngest
Young,
up
too.
until,
All righty. Thank you so much. Really, really great stuff. Mrs. Azuree Williams and Mr. Nigel Richardson. Suffice to say, I know you've reached some of our listeners out there, and that is really what this program is all about. Mrs. Williams, thank you for what you do, and Detective Richardson, thank you for being so brave on so many levels to share your story with us. We are aware of the sacrifice you have had to make to come here on Health and Family, and it is deeply appreciated. I do believe you sharing, you've given strength to males out there to get support to get through this. One of my favorite songs is by Yolanda Adams, and it simply says, The battle is the Lord's. Thanks again for joining us. I'm Shay Burgess, and this has been Health and Family.